Hi, my name is Jenni and I'm the owner and registered physiotherapist at In Focus Rehabilitation Center in Georgetown. We also have a location in Cambridge. We've had a lot of questions about what types of physiotherapy services we can offer at this time. So I thought I'd just do a quick video just to clear things up. There's a lot of questions out there about, when regular services are going to start up, if we're still offering virtual services. So at this time, we're definitely still offering virtual physiotherapy assessments and treatments, and we've been doing this now for about a month, and it's going really well. There are some conditions, obviously, that are better suited to virtual treatments than others, and this is something we can screen when we talk to you on the phone to book your appointment. So to book a virtual assessment or a virtual consult, all you have to do is call the clinic or email our clinic, and we'll talk to you and set something up. We are also allowed to offer what's called urgent care appointments. And, the definition of urgent care can be a little bit gray. And I think, we really need to define that because we certainly don't want to be practicing as we did before the COVID outbreak. We want to be very mindful about the number of people we're bringing into the clinic and the types of patients that really need to be there. So urgent care basically, is somebody who's experiencing incapacitating dysfunction or pain. So again, this isn't your, little tweak of the low back. Things like that certainly can be dealt with virtually. And also what I'm discussing with you now is what's been defined by our College of Physiotherapists. Every practitioner has a college, chiropractors, massage therapists, and I'm assuming that their definition of urgent care is very similar. So again, if you're experiencing incapacitating dysfunction or pain, we can bring you into the clinic. The college has also said any scenario where the inability to initiate care or the withdrawal of care would lead to a significant deterioration of your condition. So let's say you've just had knee surgery, if you've just had ACL repair or a total knee replacement, a total hip replacement, if you don't get your physiotherapy, you could definitely regress in terms of your condition, and anything where you might be readmitted to the hospital. Obviously, we don't want our hospital beds being taken up by things that could be addressed by physiotherapy in the community. So post-operative care, anything that involves cardiorespiratory dysfunction, so lung function. If you've had a stroke or you were previously getting neurological rehabilitation, you should still be getting some sort of care to maintain your mobility, and again, make sure that you don't end up back in the hospital. If you've just been discharged from the hospital, you should have a physiotherapist ensure that you are safe at home, again, to prevent readmission for safety. So this can either be provided through home care or, again, a virtual assessment with a physiotherapist that can do that. Any patient who has suffered burns that are incapacitating, obviously that's something that's critical. Or if you're a healthcare provider in an essential service, acute care setting, or any other setting that's deemed to be essential, you can be considered an urgent care case because obviously we want you back doing the fantastic work that you're doing with our patients in the hospital. So I hope that clears up some of the questions about the people we can actually physically bring into the clinic. It's not looking, as it would normally, where again, if you've just, tweaked your neck or your back, we can bring you in. These are urgent care cases, and when you do come into the clinic, it's a little bit different. It's one-on-one. At In Focus, again, it's just myself and you. So there's two people. We don't even have a receptionist at this time. You're wearing a mask, I'm wearing a mask, and we're following all of our regular and mandated infection control policies. So if you have any questions, and if you're not sure if your case is urgent, because again, there is a lot of gray area, give us a call, and we can talk about kind of what the best way is to manage your condition. So in focus is 905-702-7891. Somebody will pick up calls every day, every other day. You can email us at infocusphysio@gmail.com. On our website, there's more information about virtual services. I'm also going to post information on what urgent care consists of, according to the government and according to our College of Physiotherapy. Okay, thanks for listening.